Welcome to this video on X-rays of general surgery, brought to you by the Department of Surgery, GMERS Medical College, Junagadh. This X-ray shows a foreign body in the esophagus. This X-ray of the neck and chest shows a foreign body, identified as a coin, in the esophagus. The coin is seen on face in the AP view and on edge in the lateral view. This image is a view of the abdomen, showing a foreign body resembling an open safety pin. Here are sequential X-ray images taken at 1, 3, and 5 minutes, showing the passage of contrast material. These are barium swallow findings for achalasia cardia, based on a timed esophagram series. Key findings include gross dilation, distal tapering, contrast retention, and an air fluid level, creating the classic bird's beak or rat tail appearance. This chest X-ray shows an inserted tube coiled in the upper chest, as indicated by the arrow. These key radiographic findings suggest esophageal atresia with tracheoesophageal fistula, or TEF. The coiled nasogastric tube confirms the, quote, tube sign, and the presence of abdominal gas confirms a gross type CTEF. This neonatal abdominal X-ray displays two prominent gas bubbles in the upper abdomen. This is the classic double bubble sign, pathognomonic for duodenal obstruction in a neonate. The larger bubble is the stomach, and the smaller is the proximal duodenum, with gas absent distally. This is an X-ray from a barium meal study. The barium meal study reveals radiological findings, including a deformity of the stomach, bilocular appearance, greater curvature indrawing, and lesser curvature shortening, indicative of an organic hourglass stomach deformity. This chest X-ray shows the right hemidiaphragm and a dark area underneath it. A critical abnormality observed here is pneumoperitoneum, diagnosed by the presence of free gas under the right hemidiaphragm. This crescent-shaped radiolucent area suggests free air in the abdominal cavity. This X-ray shows an elevated right hemidiaphragm with some internal markings visible. This is Chilaiditi's sign, a chest X-ray finding of colonic interposition. The presence of haustral markings confirms intraluminal gas, helping to differentiate it from pneumoperitoneum. This is a plain X-ray of the abdomen in an erect view. This plain X-ray abdomen, in an erect view, shows multiple air fluid levels and a stepladder pattern with dilated small bowel loops, suggesting a mechanical small bowel obstruction. This is a spot film from a barium enema study, showing an area of narrowed colon. Key findings from this barium enema spot film include annular constriction, creating the apple cord deformity, shouldering, and mucosal irregularity. This is highly suggestive of annular colorectal carcinoma. This is a blank slide. 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 This is a blank slide.